good morning, everyone, and good afternoon for our friend in Japan. I'm Céline PAJON. I'm head of Japan research here at Ifri, French Institute of International Relations. And we are holding this webinar this morning, looking at, well, the kind of hot topic right now in the COVID era, that is the health governance issues and the various questions that it's raising and what's at stake about health governance today. And last week, we all held another webinar on the digital transformation, which is also an important topic right now. And with the same kind of perspective, we're trying to share the perspective from Europeans and from Japanese point of view to try to look at the two, the common points, differences, and to look at how also Europe and Japan can come together and can cooperate, coordinate. So we will have this same kind of approach this morning. So as you know, the COVID-19 pandemics highlighted the significance as well as maybe the deep crisis of the health governance system. The World Health Organization has been the target of various criticisms, maybe for falling under political influences, and at some point was unable to coordinate a proper international response to tackle the pandemics. Thereafter, various efforts have been made to ensure that the COVID-19 vaccine would become a common international good. However, again, we've seen various attempts, national or regional attempts to win the race for vaccine and to secure doses for the own domestic population. And this clashed with some multilateral initiatives that we also could witness. And I believe it is now quite important for important players such as the EU and Japan to position themselves in the global health governance and put forward their own strategy. So that's why this webinar this morning will discuss all these various issues regarding health governance in the COVID era by providing, as I said, a European and a Japanese perspective on the topic. And I must confess that I'm not a specialist on this very issue of health governance. So I'm very fortunate to be able to rely on 4 great experts in this panel to help me and to help us to understand what's at stake here and to enlighten us on this. And I will briefly introduce them, and then I will pass the floor and we will start the presentation. We will have a first presentation by Luca BURCI. He is adjunct professor at the Graduate Institute of International and Development Studies in Geneva, and is former legal counsel at the World Health Organization. We will follow with Susan BERGNER. She is a research fellow with the German Institute for International and Security Affairs, SWP, in Berlin. And then we will move to the Japanese side of the panel with Kayo Takuma, who is a professor at the Tokyo Metropolitan University. And then we will end with Ryoji Noritake, who is CEO and board member of the Health and Global Policy Institute in Tokyo. And before we start the presentation, I would like to encourage the audience to think about questions already for for our panelists. And if you have your question in mind, then please type them in the Q&A box that you can find on your Zoom window. I guess everybody is quite familiar with this process right now. I will collect the question during the Q&A session, and I will address them directly to the speakers. And now, without further ado, I would like to give the floor to Professor BURCI for around 10 minutes presentation, and he will talk about the WHO, the COVID-19 pandemics, try to provide an assessment and the implication for the future of the organization. Thanks a lot.
Many thanks, Céline. Good morning and good afternoon to everybody. Many thanks for inviting me. It's very interesting, this European-Japanese perspective. So I feel I'm right in the middle, trying to give a bit the international WHO perspective in about 10 minutes. So I'll give a bit of a sketchy overview, and very happy to respond to questions and to have a discussion. First of all, we are still in the middle of COVID. COVID is here, things are not going terribly well. So the war is not over, and we are licking our wounds and learning from the past. We are living the crisis. And 2 points there. First, everybody says this was unthinkable, this was unforeseeable, but it actually was very foreseeable and has been foreseen by WHO for a long time. So here is already a lesson, in a way, lack of preparedness or the difficulty for political leaders to prepare for a catastrophic event of an unlikely nature, but quite possible. And the second, and that I think shapes the conversation for the future, is the gravity of the zoonotic risk. Most of the diseases that have come to us have jumped from animals to humans, and this continues to be the case. So it sets a pattern that the international community, including WHO, have to address. So WHO is coming out, is still in trying to navigate this crisis amid praises and criticism and a lot of different opinions. So WHO obviously is at the center of a system of global health security that tries to coordinate preparedness and response. And one of the tools in the hands of the community is the international health regulations. I'm a lawyer, so obviously, and as a former legal counsel, I was very involved in the revision of the international health regulations. So the regulations have been criticized for being weak, for being powerless, and so on. But they're actually a very interesting instrument because, first of all, they are like a treaty, they're binding. They're not just a set of recommendations. Second, they really are a contemporary approach to risk. There really is a globalization of risk because the disease spread is not just COVID. It can be a nuclear accident like Fukushima. It can be an act of bioterrorism. So there is a strong political insecurity dimension there. So it's an instrument that tries to address all risks. They give a strong role to WHO, a very managerial instrument that sets quite ambitious obligation for states, including to have a resilient, well-prepared national health system, and that I think has been a general failure. That, however, codifies a certain political balance that has proved to be, in my view, a limit, which gives a lot of power to states, to WHO, but then states at the end can take the final decisions unilaterally on what to do. That was called a grand bargain. And in a way, there is a logic. States are not prepared to give to an international organization final powers on something which is so sensitive. But we see the limits of that bargain. So I think the IHR have, all in all, withstood the test, but it showed the limits. And some of the limits are, first, the system of alert based on the concept of emergency. It's very binary. Either you have an emergency, which Dr. Tedros declared at the end of January for COVID, or you have nothing. So there is a lot of difficult discussions if we can have better centralized tools to alert the international community about the growing risk. It's not yet an emergency, but we cannot wait for an emergency. We need to nip it in the bud. The second, obviously, there is a big disconnect between the idea that the national health system now are the object of international obligations. States are accountable to other states with how they manage their own system of healthcare and so on, and the reality. And this is no longer a development issue. Western Europe has done much worse than Sub-Saharan Africa. So there is a big lesson to learn there, and there is a need for a lot of reflection. The third is this grand bargain again, because it gives a sense of a relatively powerless instrument where we make alerts, we give emergencies, we make recommendations, but then states go randomly, they close the doors, they block trade, they block travel, they quarantine people, and sometimes, frankly, in a rather irrational way. I'm living in Switzerland, I'm Italian, and sometimes I really don't understand why flower shops are open, but bookshops are closed. So there is a big communication gap there. What are some of the main lessons coming out of this? We are still learning them. We are still in the middle of the crisis. The second, again, is the chronic lack of preparedness against health risks. And I must say Asia has done much better than the rest of the world. Taiwan, Japan, Republic of Korea, I think they've shown a good model, also because they had many crises in the past. The Western Europe, for example, or the United States were spared. So there was already a sense of preparedness. The second is a systemic difficulty in having an organized collective response where there is cooperation and solidarity. It's easy to talk about selfishness. It is not so illegitimate and irrational for an elected national leader to think, I have to think of my people first. But at the same time, as Dr. Tedros, the Director General of WHO, keeps repeating every day, there is an equal rationality in saying that we need to go through this together, because either we get out of this together or we don't get out of this. And so there are really interesting, almost philosophical dilemmas between almost, I would want to say mutually exclusive, but certainly diverging rational choice approaches. The third is a zoonotic risk, as I said, and there is a lot of work to do there, where the health agenda clearly overlaps with the environmental agenda. Because if we have an increasing number of zoonotic diseases, it's because of climate change, because of loss of forests, encroaching in forest, land use, desertification, and the big environmental agenda. So there are clear synergies there. And the fourth is COVID has been an amplifier of inequality, of discrimination, of inequities within countries and between countries. It has not created them, it has shown them graphically in all their gravity, from access to healthcare and now vaccine. So I hope there is mature leadership to address the point which makes the whole world extremely unstable. We see even in the Netherlands, which is not an unstable country, people fighting against the police, against lockdown and so on. This is unsustainable. If we have a new pandemic, I think we'll have a great disruption politically. What are the big changes that are being discussed? There are a lot of discussions, obviously. There are several review groups. The G7 is discussing, G20, European Union is leading a resolution for the Health Assembly that should start an intergovernmental process. Many things are being discussed, and they will converge this year on the General Assembly, on the Health Assembly in May, on the G7, G20 meetings. So I hope there will be at least starting processes. So very quickly, the first is a need to strengthen WHO and the IHR. There are many points of weaknesses there, from the flaws in the instrument to the lack of proper financing for WHO and so on. The second is, I would say, the institutional design. WHO has a long ethos of depoliticizing public health, and that's why the IHR are largely managed by the Secretariat. States are taking a step back. But I think COVID shows that states have to be back at the center of the action. We need a different, in my view, governance model within WHO and more broadly. The third is how to address the gaps. The IHR and WHO can only go so far. And hence the European proposal for a pandemic treaty, which is gathering momentum, is still very vague, but is probably will dominate part of the conversation in the next few months and years. The fourth is health systems. As I said before, a system of global health security cannot work if we don't have resilience, well-financed, equitable and balanced health systems at the national level, regardless of the level of development. The fifth action, and I come to an end, is prevention. Zoonotic risk means prevention. Prevention now means we have a disease and we contain it. No, we need to go upstream. We need to map and regulate the points of contact between animals and humans, whether it's livestock or wildlife, because we know where the risk is coming from. And it's self-defeating not to regulate that zoonotic interface. And finally, I would say financing. There is clearly a need for a different system of financing, both at moments of emergencies, but more importantly, in peacetime, between emergencies. Both financing international preparedness and sustainable financing of health systems. That has to come largely from the states themselves, but also from international sources. And the system of development financing, in my view, is not tailored for that. We need to think differently. And finally, we need agreement on principles and values and big strategic direction. The COVID has shown how the knee-jerk reaction is isolation, selfishness, nationalism, like there is no common values. It's not true. There is shared vulnerabilities. COVID has shown how nobody's safe. So I think it's a moment at the political level to assert not lofty Boy Scout kind of principles, but solid values that have to guide future action, that have to be a blueprint for politicians, both at the national and international level. The United Nations has been, I must say, kind of missing in action, have been disappointing in my view, but that to me is something that I would see institutionally moving within the General Assembly, moving within the highest instances of international decision-making. I will stop there. Many thanks for your attention and happy to have a discussion later. Thank you.
Thank you very much, Professor BURCI. I think it was a wonderful discussion setting, a lot of food for thought already. So great job, thanks a lot. I'm now turning to Professor BERGNER, and she will speak about Europe and the COVID-19 crisis, the challenges and opportunities for EU global health strategy. The floor is yours, Professor BERGNER.
Yes, thank you. I'll just share my few slides, just a few. Don't be scared, it won't be too long. I'll keep my input short. Actually, I will later respond a bit to Gian and Luca because I really liked your input and it mirrors some of my thoughts actually on regional level, because here we also have this bargain issue between member states and the European institutions as well. And the last point that you've made with the strategic orientation, principles and values, actually this is my focus of my short input today. I will focus on the challenges and opportunities for an update of the EU Global Health Strategy actually. And I focus on the strategy because I think it can be considered as one of the main drivers to take on a sustainable and long-term role for the EU in global health, because it gives a strategic compass, let's say. We've seen and we've heard right now that there was quite a bumpy start when we look at the EU closing borders, export bans on medical goods, and then the EU put itself together and said, okay, we see a retreat of the US, we see a retreat of the UK, two of the main global health actors, and we have to step in, this kind of feeling after the first shock, let's say. And then the EU hosted 2 donor conferences for the development of vaccine therapeutics and diagnostics, and launched Counsel conclusions on the WHO role, actually contributing to the debate. So we've seen financial support for the WHO. So we've seen kind of an effort from the EU side, actually. However, now the EU is struggling to live up to its words, and we can talk about this later in the discussion even more. I just want to show a few challenges that I've identified within my my research so far. I'll focus on the outdated global health strategy in a few seconds. I'll just say a few words to the other ones. So we have a fragmented global health budget in the EU. There's no global health budget, actually. We have a fragmentation of different budgetary lines. And we have also fragmentation of actors. So that is not bad per se, but it leads, and that's what we've seen, to a lack of coordination and coherence on EU level. We've had limited health competences. Now it's in discussions, but this is actually the bargain between member states and the competences of the EU in health. And this, of course, can impede the EU to take on a broader role in global health as well. A strong focus on diseases and disease control and disease management, even before COVID-19, neglecting a health systems approach. Also financially, there's a strong focus on initiatives that focus on vertical, that's how we call it, and vertical intervention. So on diseases instead of a horizontal, broader intervention. And what Gianluca has already mentioned, we have a lack of a linkage between, for example, different policy sectors, for example, climate and health on EU level. There are no multi-sectoral initiatives or strategies for that one. Global health diplomacy, we do have on EU level 2 positions, I think, in the EU delegations in Geneva. But 2 positions are not a lot, considering that the EU could be way more strategic in global health diplomacy. And lastly, global health has not been a priority for the EU before COVID-19. Health popped up, for example, when we've seen the Ebola outbreak in West Africa, but then actually all the attention were taken by other crises within the EU. So the question is also, how can we sustain this kind of momentum? And this is why I will say just a few words on the Council conclusions on the EU role of global health. They date back to 2010. Actually, so over 10 years ago right now. And this timeline is just an illustration. So illustration of key developments that have happened between those 10 years. And this is, of course, not exhaustive, but it already shows just a few of them. I've just listed a few of them to show that the strategy cannot incorporate all these experiences that we've gained in the past years in global health. So an update makes sense. And there's also the momentum right now to have the backup of different policy actors, because what we've seen in 2010 is that the Council conclusions were mainly backed up by development actors, and there was no buy-in from foreign ministers of member states of the European Union. And now we have this kind of overwhelming pandemic here, so we have that can resonate actually into the political sphere. Right. And we've also seen the connections that haven't been that pronounced with health to intellectual property rights, to manufacturing capacities worldwide right now, health systems already mentioned. So all this could flow and develop into a broader and more refined global health strategy of the European Union. On the other side, there's also the argument that says, we don't want to open up a lengthy process right now. This will take time to develop a new strategy. Do we have the time actually to do that and the energy to invest in this strategic process? And then maybe at the end of the day, the new strategy will be not much better than the old one, because it might be just focused on crisis prevention and control, because we have a pandemic right now, and this is on policy level, we tend then to have an emphasis actually on short-term measures instead of long-term measures, right? So here it might even reduce actually the outreach of the global health strategy at the end of the day. So these are also concerns that we have to take into account. But I want to finish on a bit more positive note, and that's why I outlined some of the opportunities that I see in current debates of within the EU, but also internationally. So we have that kind of idea of a European Health Union right now that came to the table. And here you also see minor parts, but you see parts that refer to global health activities that could be strengthened, in my opinion, but you see that there can be a backup for the EU to step up its global health role. We have a EU health program that finances health activities within the EU, but health has also a budgetary line for global health activities. So we have one more budget for global health. And we've seen the initiatives, Gianluca already said, the EU proposal for a pandemic treaty. We see the EU involved in debates about the reform of the WHO, participating in the Access to COVID-19 Tools Accelerator in this new instrument. And these efforts show that the EU is now willing to be more visible, at least, in the field of global health. And on the other side, we see also more pressure from the civil society. There has been a shadow global health strategy, it's called Towards a New Global Health Policy, from civil society actors and a manifesto for European Health Union. And this already shows that there's also more awareness in the broader public for the EU to take on a greater role. But at the same time, we see a lot of criticism and controversial issues right now because the EU is engaging in, let's say, vaccine nationalism. And I'm happy to discuss this with you later. I'll stop here for now and hand back to you, Céline. Thank you.
Thank you, Susan. It was excellent overview of the EU position on this, and thanks for the opportunities part at the end to try to see the end of the tunnel or something more optimistic. Yeah. So now I would like to turn to our Japanese experts to look at the other side of the world and to have a kind of mirroring also views and perspective on Japan's role in the present and post-COVID global health governance. And for this, I will leave the floor to Kayo Takuma. Professor Takuma, the floor is yours.
Okay, thank you for your kind introduction. I'm Kayo Takuma. Good morning, good evening, everyone. I'm Kayo Takuma from Tokyo Metropolitan University. First of all, I would like to express my deepest appreciation for everyone who organized and prepared for this precious webinar. It's a great honor for me to be here as a panelist. Thank you very much. So let me share my PowerPoint. Okay, let me introduce. Okay, so today I will speak about the Japan's role in the present and post-COVID-19 global health governance. Let me introduce myself briefly. I have researched the history of international health governance. With a focus on its relationship with the changing international political order. In this regard, I have been engaged in several projects such as comparative study on G7 countries' contribution to global health governance. My latest article is the global solidarity is necessary to end the COVID-19 pandemic, which was published in the latest issue of Asia Pacific Review. Let me start my presentation. The reaction to COVID-19 has been largely political, and the governance to politically damaged to be organized. Under such a situation, the role of middle powers, including Japan or EU, is increasing. From that perspective, this presentation will examine what role Japan is expected to play in the present and post-COVID-19 health governance. First, let me explain why the response to the COVID-19 has been so political. A century ago, control of infectious diseases was regarded as non-political and highly specialized issue. In contrast to that, the response to the COVID-19 is closely linked to politics. This is because the spread of infectious diseases is no longer just a threat to public health, but a global crisis, as it can paralyze the world economy or our daily lives or society. In this globalized age, where we are closely connected through travel or trade, infectious diseases can spread very quickly, and its impact can be global. The control of infectious diseases then has been redefined as part of security issue, rather than just a public health issue. Actually, such an idea such an idea that control of infectious diseases is no longer just a public health issue has recently been shared widely, and the world has responded to public health emergency such as HIV/AIDS or Ebola virus outbreak very politically. Regarding the Ebola virus outbreak in 2014, for example, a World Summit was convened under the auspices of the then US President Barack Obama, and the UN Security Council agreed to establish the UN mission for Ebola emergency response, which responded to the epidemic in collaboration with the UN mission in Liberia. The Ebola epidemic ended after about an year under the US leadership and through global solidarity among various actors, including the WHO, UN, or World Bank. In contrast with the response to AIDS or Ebola, the response to the COVID-19 lacks international cooperation, not to mention the US leadership. The former US President Donald Trump has denounced the WHO as too political and too close to China, and announced the withdrawal from the organization last summer. Conversely, China supported the WHO, which transformed the WHO into a battlefield between the US and China. As I explained, the current pandemic can affect a wider range of fields, which render the response excessively political. In some, the My Country First policy and the US-China confrontation has had a great impact on the global corporate framework. The US, which had led the diplomatic negotiation in this field, turned its back on international cooperation under the Trump regime. The Biden administration returned to the multilateral cooperation, but it is too busy controlling the domestic situation to spend enough time and energy to take leadership in multilateral cooperation. Meanwhile, China extended its influence in global health governance. In this context, the role of middle powers is crucial. These countries have been actively involved in various multilateral frameworks, such as leading the adoption of resolution at the WHO or engaging in the COVAX facility. As one of middle powers, expectations for Japan have never been higher than before. So let's move on to the next session, where I examine the role Japan is expected to play. Even before the COVID-19, Japan had been prioritizing the global health in its foreign policy and promoting universal health coverage through multilateral and bilateral framework. Japan's constitution does not allow the use of its military, which pushed its diplomacy to focus on human security and global health. As one of G7 summit members, Japan played a crucial role in making global health a top political agenda. In the present and post-COVID-19 era, there are various fields in which Japan's active role in health governance is expected. The first is strengthening the health system worldwide. The world realized how crucial the organized health system is for preparedness and for controlling the epidemic. The Japanese government assisted many countries to strengthen their health system and health insurance system using Japan's technology, experience, and products. As this picture shows, in Uganda, a hand washing campaign was launched in cooperation with a Japanese company that manufactures health and hygiene products. Japan should expand such assistance further through bilateral and multilateral channels. The second role for Japan is to collaborate with neighboring countries for its pandemic preparedness. Of course, this should be conducted at the global level. However, as this pandemic shows, the global cooperative system is far from perfect and is now being overhauled. Thus, the importance of regional cooperation would be all the more important in the post-COVID-19 era. From this perspective, Japan should make efforts to strengthen preparedness by establishing a regional monitoring system and cooperative system of research and development, utilizing the existing framework such as tripartite health ministers meetings or ASEAN plus 3 framework. And the third role expected of Japan is to initiate efforts towards ensuring equal access to vaccine. While the world is hoping for a quick resolution of infection, the vaccines are the only solution that we can rely as of now. Many issues, however, are related to the supply and distribution of vaccines are yet to be addressed. The uneven and unfair distribution of COVID-19 vaccines is the most crucial problem among all. According to the UN Secretary General, Antonio Guterres, 10 countries have administered 75% of all vaccinations, while 130 countries have not yet received a single dose of vaccine. It is important to note that equal access to vaccine is necessary, not only from a humanitarian perspective, but also it brings the benefit of quicker convergence and economic recovery. Japan's role will be increase the efficiency of COVAX by convincing countries of the importance of equitable access, calling for their participation and convening the international conference to reaffirm the importance of equitable access to vaccine. And developing the approval system for the vaccination produced in non-Western countries is also expected for Japan. At present, there is little data on information on vaccine produced in China or Russia. The approval system should be entrusted to a multilateral framework, such as international organization or international panel of experts, and Japan is expected to play a leading role in creating such a system. Furthermore, similar to how Biden administration broke out a pact between Johnson & Johnson and Merck for Johnson & Johnson's coronavirus vaccine production, Japan should also make efforts to promote vaccine production. So I think that's out of time. So that's my point of view. Thank you for your attention.
Thanks a lot, Takuma-san. That was an excellent presentation, excellent overviews of Japan's positions right now. So last but not least, I will now turn to Noritake-san for a view on Japan's experience in tackling COVID-19 and its reflection in terms of health governance. The floor is yours.
Thank you. Thank you very much for the kind introduction, PAJON-san, and my colleagues and the panelists. Good morning, bonjour, good evening, konbanwa to Japan. I already learned a lot from your presentations or panelists that how global architecture for health security and health governance is needed in this critical time for the world. But my presentation would focus on how to achieve that with the consensus to general public in each country. So that with that context, I'd like to reflect what Japan's experience is in tackling COVID-19. HGPI, where I serve as a CEO or housekeeper, is a boutique healthcare policy think tank based in Tokyo. We are non-profit, independent, and global. We bring various stakeholders together to address the urgent issues in healthcare, including AMR, health governance, women's health, non-communicable diseases. Let me quickly look back what Japan's experience was. Firstly, the death number for COVID-19 in Japan is quite small compared to Western societies, Western Europe and United States. The total death number as of now, or yesterday, is 8,299, which is quite smaller compared to Western society. And as Gian mentioned at the very beginning, the situation is very similar in Asia. The light green is the Asian portion. And it's not growing, interestingly, that even though the epicenter was Wuhan, China. Addition to that, Asia also has a unique status of aging, particularly in Japan. The aging status of Japan is quite high compared to other countries due to several reasons. One is rigorous migration control and lower birth rate, of course, and longevity. So these combine actually the super aging society in Japan. The aging population was the most vulnerable population to COVID-19. But how Asian nations control better? We haven't received enough evidence or scientific analysis yet. But one showcase here is Japan's uniqueness in terms of countermeasures for COVID-19 for aging population. This is a number of the COVID-19 death per million population by country. In Japan is a red dot, is Japan. And population age 65 and above, the ratio, the percentage of total population is in horizontal way. And you can see how Japan control relatively better or exceptionally better actually in terms of protecting elderly, seniors, aging population from COVID-19. There are several reasons behind it needs to be analyzed more rigorously. But one is that in early February in 2020, the Ministry of Health announced the regulation to visit long-term nursing care homes to prevent the outbreak in those housing for elderlies. So that is actually the one best practices that Japan can share to the world, I would say. In the last 5 minutes, I would like to discuss a little bit more about observation and discussion that what we need to discuss globally, especially with the context between Japan and EU. Firstly, the successful experiences or so far lessons, which we controlled relatively better about COVID-19. There should be some systematic reasons, biological preparedness, better hospital preparedness, well-trained infectious disease doctors. As Gian mentioned, the disaster, which Japan is quite a disaster-friendly country, so we have more experiences on that. But I would like to point it out from anthropological background, there should be some cultural norm as well. The mask wearing, even before the COVID-19, is quite common norm in Japan, physical distancing, and high standard of sanitization. That might contribute to the low death number in Japan. And another interesting sort of observation is we implemented voluntary-based lockdown, not with the punishment, but governments voluntarily requested the population, people, to stay home, and which worked well so far. As Gian mentioned, there is some solidarity in society. Perhaps that's one reason. And the further discussion needs to be taken place, how we can control private right versus public health sort of a well, or the collective happiness. Another point I'd like to point out is the sort of a rise of or redefinition of nation state. I think COVID-19 was one of the major global situation that nation state was highlighted. Susan mentioned about the the politicization, or Professor Takuma also mentioned about Kayo also mentioned about the politicization of COVID-19. But when it comes to the role of nation state, after the Cold War, we discussed about how to open the borders. But now we discuss about how to close the border. And the role of nation state is exceptionally highlighted again in this globalized society. In Japan, that was a sort of a same situation. We also have Infectious Disease Control Act. And one interesting characteristic of Japan is we have more horizontal collaboration between nation state, municipal government, prefectural government, which is like a state government. So that nation state does not have rigorous right to order the municipalities to follow the rule of infectious disease control. So we needed to have some voluntarily proactive step up from municipalities to control the population or to inform the population how to react to this pandemic. There are some best practices that public health centers in Japan, in municipalities, actively worked well. But on the same time, we need to re-narrate the importance of nation state in the context of how we can keep the balance between nation state and municipal government. As of now, Japan still has a state of emergency in certain prefectures, which is like a states. And Tokyo governor is try to step up to inform, to protect basically her population. But also there are certain sort of a sensitive dilemma between who control better, who take leadership between governors and prime minister. Lastly, as a discussion, in terms of EU-Japan framework, we need to be carefully noted that there's a dilemma of democracy, sort of at least the perception of dilemma of democracy we need to be recognized. In terms of data privacy or personal space, that Western society, actually including Japan, did not control population well compared to perhaps authoritarian nations or top-down nations. How we can re-narrate the importance of public health. Michel Foucault mentioned in 1970s that the biopower that nation state control people originally by sending them to death sentences, but now nation state control people by saying how to live, how to be healthier, how to live. And I think this sort of like a dilemma actually brought certain Protestants in Western societies, including Netherlands. And that was very intriguing, and unfortunate, but also intriguing phenomena. And we need to a little bit break down what we need to do to communicate with the general public. So yes, I do agree with the health governance, global health security platform or architecture, but also we need to re-narrate, rephrase how we can risk communicate with our own people, how we engage people, how we take the civil society-based approach with the support from municipalities and local governments. In terms of that, I think I do agree with Professor Takuma, Kayo-san, that Japan can take a unique position. It's based in Asia, and we took rather harmonized methodology for controlling COVID-19. So there should be some context that discourse that EU and Japan can share the lessons for better health governance and better health security global architecture. Thank you very much. Merci beaucoup.
Thanks a lot, Noritake-san. That was really great, great one. Great focus on Japan, and also thanks a lot for bridging the the EU and Japan, and what are the stakes to the common of the current situation for the two players, and how they can come together and try to coordinate. I think it's really fascinating to have several perspectives and several views on this issue. So I would like to first make a first round around you to ask you for your reaction on each other's presentation and on various points that you may agree or disagree with, or you want to push a little bit further. We have one question also coming for the public, and I'm encouraging the people who are watching now to type your question. It's now or never. We have only dozens minutes left to address them. To try to gather maybe the main points, and to encourage you to react. We talked about a lot of things, but I think it was interesting to look at of course the geopolitics of the crisis management now, and how try to mitigate the negative side effect of the great power competition in the detriment at some point of the global governance and the global cooperation on this. Several of you mentioned this dimension, so I would like to know, in your perspective, what you would be the most urgent things to do, what would be the most important recommendations to implement, be it at the WHO level, or at the state level, or regional level, or at the level of the EU-Japan partnership. We have a strategic partnership agreement between the two players, and they can both work on this. So what would be the main point to highlight? We referred to also to capacity building assistance to build the capacity and build the health domestic health system in third country. I think that would be also an important area in which both the EU and Japan can act and can act together. So what would you see at the next step for both the EU and Japan in this area? We also talked about how to engage with the people on this, and how to engage with the NGO, the civil society. I would like to know also your viewpoint about the private sector. What about the pharmaceutical sector players, like very, very important key players right now? So how to engage with them, how to work with them in the most efficient ways. And that would be the starting point right now. There is, just to recall, one question on the opportunity to generalize the health controls on borders right now, especially before entering closed areas such as airplanes and so on. So this is raising also an issue that Noritake-san addressed at some point. Where should we put the line between freedom of circulation, security, also human security, national security now, regarding health issue and the control of pandemic, and how to draw the line and find the right balance between the two. It's quite tricky, and depending of from where you're talking to, you can find very different approaches. So those are the first question to you. So I would like to maybe come back to you in the same order. Maybe Professor BURCI first.
Thank you. You want me to address the questions from Mr. Topi? Or?
Oh yeah, you can do that
you?
and also react to others and address the questions that I raised, but you can just address whatever you want, whatever you prefer.
Yeah, in terms of the question on airplanes, obviously air travel is one of the biggest problems because globalized air travel with billions of people traveling around the world without much control is a super spreader. H1N1, influenza, and now COVID has been globalized in a matter of weeks, largely through air travel. And at the same time, the aviation industry had taken a huge blow. I was listening to BBC today how Cathay Pacific has to write off about $3 billion, had a collapse about 90% in traffic. So here we have a big economic sector that is too big to fail, but in a way is on the brink of failure versus a major health risk. That's nothing new. And ICAO and WHO have been cooperating closely for decades, I would say. It's easy now in a way because you know the enemy. It's a respiratory disease. You can impose masks. You can impose a negative test as a condition for checking in passengers, but these kind of measures are difficult to streamline at peacetime because you don't know what the next enemy will be. So I think there will be a difficult dialogue among sectors, but also within the industry and in ICAO, which is obviously the International Organization on Civil Aviation, whether to increase controls. Mr. Topi mentions the post 9/11, that I think is an example which is made more and more often, for example, with regard to surveillance. But at the same time, cannot be something that makes either we rethink the system of globalized travel, or I think that the balance will be more in favor of the industry. At this point, is largely contact tracing and how to manage situations that are detected rather than trying to prevent the risk, because that's very difficult, including incoming screening. I remember when I was in WHO, Australia during H1N1 imposed thermal screening in most of its international airports, spent billions of dollars, disrupted a lot of travel because there are huge queues coming in. And I think it detected maybe less than 10 cases of H1N1. So there's also the balance which is implicit in risk assessment and risk management. If I can ask a question, that is to Susan. So the EU has taken the lead during COVID. They has coordinated the resolution that was adopted by the Health Assembly last May, is doing the same for a resolution launched in a new intergovernmental process for the Health Assembly in this coming May, the pandemic treaty proposal and so on. So to me, it's clearly trying to fill the gap left open by this US-China rivalry, and it offers a political space. But does that go together with the sense that the European institution now should be equally strengthened? Because there's always this Brussels tug of war between the states and the union. Shouldn't do the two things go together, or is there something that should be left to states? It's something very political, so it shouldn't really alter the internal architecture of the union in political terms, because I can see this debate already looming between Commission and Council and so on. I'll stop at that. Thank you.
Thanks a lot. So Suzanne, you have another question more to answer, and I would like to add another question from the public, especially on the vaccine nationalism, that point to the dilemma that the states, governments can have, that they need, it's their responsibility to protect their own population, but at the same time, they also are eager to participate to international efforts to how to coordinate the two and to reconcile these two. And I guess we can think of the EU right now. Even among the member states, there have been some complicated issues. So how to reconcile that at the EU level, and how can the EU also can coordinate with partners, international partners. Thanks.
Yeah, a lot. I'll I'll try to answer a few. At least I'll try to share my thoughts on that. So first of all, I think, so to the last question, I'll start with the last one on how to reconcile, to balance actually domestic and national protection, and then the international responsibilities that the EU and member states have. And I think we underestimate the general public, because I've seen just a study of the Kerber Foundation. They are asking Germans and US citizens and saying, okay, should Germany step up its role in global policies in general, not global health, but global policies in general, even if it might limit their own national interest? And still the majority says, yes, it should do so. So this is just one example where we can see we can communicate to the public that it is needed, that an international effort is needed, also in order to be safe at home, and that's the first reason. For the second reason might be economic problems and troubles that can come up when supply chains are disrupted, etc. And thirdly, of course, because of just ethical reasons, right? To say why should we have the bulk of vaccines, and we even have more vaccines secured than we can consume in Europe? So why can't we share them? And I think at least these three reasons can be communicated to the public. And I think there is not much willingness to communicate it, or not much capacity to do so. I just ask it, do you want to do so? And can you do it? And I think there's a lack of both. And in Germany, just taking a German example again, we have elections coming up. So here you have the problem of realpolitik, so politics between, so the real politics, let's say, that are conflicting with interests on the global scale. So I think all these political aspects like elections also have to be taken into account. And on EU level, I definitely see this conflict between member states. They don't want to give up their national competences in health, especially also drivers in global health. For example, I take the example of Germany again. Let's take it again. They don't want to be like, let's say, they don't want to be the scapegoat when talking about stress tests for health systems, because nobody wants to know how bad their health systems are, right? And so here you definitely see a clear tension between them, but at the same time you see a willingness to step up. And I see this duality on EU level. Well, EU level, because EU level has to balance it, and member states level. You can see foreign ministries have a different language than, for example, health ministries, or maybe also the ministries for economy. So you see this kind of fragmentation even within countries. And I think this is the real problem here. And here I'm also not so optimistic, actually, that the EU can be a European health union in the deepest or broadest sense, but it might more have some kind of smaller changes and say, okay, we're talking about crisis management, for example. Here, that is a big difference. I just have to last thought that I want to add, I found very intriguing, the idea of the community level engagement. And here I think that Japan and the EU could work together on the narrative of health systems and UHC, as Kayo Takuma has already said, right? So Japan is really eager in the UHC debate. Other global health players like the US are more on the health security narrative. So this is a clear lack, I think, and where Japan and the EU could step in from my perspective. And then I think the connection from community over the regions. So I'm just thinking about what Ryoji Noritaka has said. So I'm thinking about how can we engage community levels over, like, from Europe to Japan in health. I think this would be quite progressive, and we could really change health governance here. I'll stop here. Sorry for the long intervention.
No, Susan, was great. Thanks a lot. Kayo, I understand you want to react,
Yeah.
and you're welcome to also address other questions.
May I make a brief comment on the vaccine nationalism? Like other developed countries, Japan is also now having difficulty in how to balance the international commitment and national, and securing national interest. And like other countries, Japan has concluded bilateral contact with Pfizer and AstraZeneca to secure its own vaccine. And that far behind the other developed countries, Japan has just started to vaccinate the medical staff last month. And as a host country for the forthcoming Olympic, I think that the top priority for Japanese government seems to secure vaccine and inoculate as many people as possible. On the other hand, Japan joined the COVAX, and today's Yomiuri Shimbun reported that Japan, US, Australia, and India agreed to establish the cooperative framework to supply the vaccine to developing countries. So I think that that Japan should realize that national interest is closely linked to the global distribution situation, and with that recognition, Japan should build up such efforts in order to achieve equal access to vaccine. Thank you.
Thanks a lot. Maybe I will follow up on your reference to the Tokyo Olympics because there is a questions about recent poll showing that up to 80% of people in Japan favor cancelling or postponing the Olympics. So how do you explain this lack of support for holding the Olympic? Do you think it's related to the pandemic fear or something else altogether? So maybe I will give the floor to Noritake-san, and then I can come back to Takuma-san on this and others.
Thank you. This is quite personal perspective, but firstly, if we see some past data for the support of Tokyo Olympic, it never became like huge support from public. It's actually, I think it's the case for any country these days, whether Paris would host the Olympic or not, whether Los Angeles would host or not. Olympic originally was festivity for everyone. But nowadays, some people criticizing it, it's not sustainable or environmental, or it's too commercialized. So Japan was on the same kind of page about the Olympics. So we didn't get any like bigger support even from the beginning for Tokyo Olympic. And I would say it's not just about pandemic situation, but it's more like some politicization of Olympic or some scandals regarding Olympic or overwhelming budget. So I think the combinations of these facts contributed to this less support for Tokyo Olympic. And for Tokyo Olympic, I think the only possible perspective to hold Olympic is back to the basic, back to the concept of Olympic. What we can do for athletes, what we can do for sports. Maybe we cannot welcome the fans, but we can still welcome some athletes with the appropriate testing and tracing. So that is sort of a scientific challenge to have new normality of Olympic, a rather frugal innovation for Olympic. Thank you.
Thanks a lot, Takuma-san.
Yes, in my opinion, I think that holding the Olympic in a normal home, I mean that with numerous audience from both home and abroad is difficult unless the vaccine is distributed equally worldwide. However, the Japanese government has a strong will to convene the Olympic in this summer. So I think that how to convene a safe Olympic while controlling the virus is an issue for Japanese government.
Sure. So we have only few minutes left. I've seen another question on the EU and its failure to secure a vaccine dose. So I wonder if Susan, you would like to address this. There are a couple of questions just raised right now. Let me look at them. on the international plan and response to US unilateral sanctions against some countries like Iran that are engaged to COVID pandemic. I'm not sure if somebody wants to take this one. Another one on the balance on public health and maintaining travel. So, and health messaging, do you see any new normal, Professor BURCI, in terms of regulations and on travel and control of health on this? Yeah. So yeah, that would be it. Only few minutes left. So if you are interested by one of the question, and if you have one burning last word to add, please feel free to step in. Suzanne,
maybe I'll give a very quick
to
the excellent question about travel. COVID-19 probably will remain endemic, like influenza is endemic, like many other diseases are endemic. We are risking a lot in this message of eradication. We need vaccines, we'll get rid of the problem once and for all. Probably it will never be possible. So I think there is a talk, going back to what Dr. Noritake said in terms of communication, I think there is the need to recalibrate communication. Influenza is endemic, and probably COVID will remain the same. So in terms of the balance, public, private, restrictions, normality, including travel, I think that's a message we'd have to give. Vaccination will be part of the solution, but people probably will continue to get sick. Like hundreds of thousands of people die every year of influenza and nobody notices. And one quick comment, because I was very intrigued by what Noritake said about this horizontal cooperation. I think the challenge in the future will be the cooperation from global to local. Because things are done at the local level, cities and so on, cities that take a region, that take a huge role. And that will have to be articulated in political terms, in legal terms, and also in cultural terms, going back to what you said on cultural norms. I think there'll be a big challenge, but I think it gives a lot of tools to better be prepared in the future. And many thanks.
Thanks. Who would like to step in, Suzanne?
Yeah, I'll just answer to the question of the EU failing in distributing vaccines. So the EU didn't fail in securing vaccines, as I said, they secured more than enough. The idea that they failed in distributing vaccines is ignoring some kind of structural problems. And this is that manufacturing capacities are not enough. And so these can't actually produce vaccines in such a short time in a high amount. So this was due to happen, but what the EU, one of the mistakes that the EU did was to create false hopes and expectations and saying we will have it next month or we will have it immediately. And this was definitely a wrong step from the EU, but this is why a lot of countries are arguing for diversifying manufacturing capacities indeed. And I have also one question for Kayo Takuma and Ryoji Noritake, because I will be very interested in hearing your ideas and thoughts, actually, how the EU and Japan can cooperate more effectively in global health. How could this look like? Thank you.
Thanks a lot. Who wants to respond to this?
Go ahead.
Go ahead, please. Please go ahead.
Thank you. Well, it's not to answer the question to Susan, unfortunately, but I think the global architecture collaboration, even between Japan and EU, so that can be an actual answer, but can be sort of woven sort of type of collaboration. Originally, the state and state discussion was main, but needs to be with municipality to municipality, governor to governor, city mayor to city mayor, civil society, NGO to NGO. And this kind of woven sort of a collaboration would be the next step. And I do agree that city is critical power or capital of each country, has a critical power these days. Like in Europe, what they call in English, the Hanseatic League of commercial German treaty in medieval time.
May I make a brief comment? I think Japan and the EU can collaborate on many issues. That Japan supported the WHO reform plan drafted by EU, and also and they are both a strong supporter for COVAX. While the US cannot spend enough time and energy on the global health, and China and Russia are rising, I think that Japan and the EU are responsible for leading the global health governance in the post-COVID-19. Thank you.
Excellent. If nobody has a burning point to raise right now, I think our time is up. So I would like to thank our fantastic lineup of experts. I really enjoyed all the presentations and remarks. And I thought that the discussion between the two sides, the European and Japanese side, is quite fruitful. So it should be taken at other levels and try to enrich the discussion and the debate and make our cooperation advance on this. So with this point, I would like to thank the audience also for being with us, and have a good day if you're in Europe, and a good evening if you're in Japan. Hope to see you soon for another session. Bye-bye.
Bye. Thank you. Merci.
Bye-bye.
Thank you.
Thank you very much.
Bye.